Have you been contemplating plastic surgery as you age? A lot of us do. And a lot of people think it's just superficial and just for the look. And hey, maybe it is going to make you look better. But did you know that it could actually change your life in other positive ways? I'm so excited to introduce today Dr. Angela Sturm. She's going to show us how changing your look may change your overall well being and really make for a happier life. So, welcome, Dr. Sturm. So excited to have you on.
Thank you. I'm very excited to be here. So thank you.
Great. Well, tell me a little bit about yourself, Dr. Sturm, your practice. Tell me a little bit about your story.
So I'm a facial plastic surgeon in Houston. I grew up in a small town, but now I'm in the big city of Houston. We have kind of a small concierge practice. I only do surgery on the face and neck, so that means like facelifts, lasers, rhinoplasties, eye lifts, all those kind of good things. And like I said, we're in it for the personal relationships, because we get to know people, and then I have patients I've had for almost 15 years, and it just makes it really fun to get to know them and their family and have that relationship.
It's a really nice connection. It's interesting that you say that because I feel like most surgeons aren't really known for being super personable. And I don't know, I haven't had tons of experiences myself, but I don't think if you wrote down most personable profession, surgeon pops up to the top. And so, you're so friendly and kind. Tell me a little bit about how you and your team build rapport with patients and really do build that deeper connection.
Uh, we all really enjoy people. Like, we enjoy their story, and so it's really fun that we get to talk to so many different people. And I'm just fascinated by everybody and how they got here, because I have patients that have done so many amazing things. And so it's always a fun conversation around the nurses station of like, oh my gosh, did you know that she did this or that or the other, and if you're not in it for the tea and plastic surgery, I don't, you're missing out. Yes.
Hi,
Yeah.
100%.
Yeah, we have the best patients, and so as you know, it's all making connections and relationships, and so finding that thing that we have in common of, do we both have kids? Do we have dogs? Do we, what have you done? And I think we've done a good job of building a really good team that everybody has that same, like, we're just super interested in our patients and just meeting these new people, and it
Right. Such a vibe that you've created. It's really the culture you've created for your team. So you're the point of that. You've done it. Like, that's incredible. And when you think about something so personal like adjusting your face, doing something that connection seems more important than anything.
Yeah, I guess you really have to know like who that person is and how they see themselves in the world and how they want the world to see them. Because we've all done that where we look in the mirror and we're like, oh, I'm tweeting. I don't know who this person is. I don't know this happened. You know, you know, what is it that they're looking for and how they want everybody else to see them. You're like, I look mad, but I'm not mad. I'm actually a really happy person, and so how can we make everything match? So it's really important to get to know that person, and it's so like what we do is so fun because we can have conversations about gender and ethnicity and your background and your family, and oh, this was my dad's nose, and I don't want it to be as much as his, but I do want to still look like him, these like, big personal conversations. So it is really important that we all feel comfortable, and that I've had colleagues that'll come in and they're like, oh, why don't you do Botox here and there and there, and they're pointing out all the things that are wrong, and you're like, you know thank God.
That's not what we're going over here. I go, I don't know.
I would ask for that, and so it's more like, okay, well, what are you thinking and what are you feeling, and how can we, because that's what we're here for to do, is like help you along this journey to feel your best. So I just hate those conversations where they're putting things out that are wrong. I'm like, no, you got lots of really good things, and we talk about all right things.
Exactly. So, it's interesting that you say that because you talk a lot in your work about the landscape of medicine changing. So, what does that mean to you? What do you see in that space?
Um, you know, as you know, it's changed a lot since I've started 15 years ago, and it changed a lot over COVID of what medicine looks like, and what, some of the reimbursements aren't as good as they used to be, and people are making physicians are making decisions to take insurance or not take insurance. And I think people are a lot more educated about their coverage because you may have coverage, but you may not have access because this physician decided not to take it. So, like, what you do is so important to help people navigate that. And I think people are way more educated, which is a really good thing because I think before we were just like, oh, I have insurance, it covers it. It's, you know, as a patient, and now people understand it a little bit better, like, well, maybe it will and maybe it won't. And
Let's have that discussion.
yeah, and what is this for me? What do I have? How can it, it's a complicated thing, and how can I navigate it? Yeah.
Right, 100%. No, I see the same. Exactly. So, I think when we think of cosmetic surgery and plastics, there's this perception around how I'm gonna look, right? I just want to be staying young forever and just look perfect and chiseled and all the stuff, right? That you hear and the media kind of perpetrates that and so forth. But I know in reading up on you and learning about you that your work goes well beyond the look, right? Obviously, nobody wants to look worse, right? And I definitely would have look more pouty or more upset, right? So all those things when you're kind of going through the advice. But how do you feel your work and your practice, you're changing lives beyond the look?
One of the best things people say to me is like, now I see myself again, and it's not about being different or changing it. It's I look in the mirror. I had a patient say that, like, I sat down at dinner with my husband and there was a mirror across the way, and I was like, and I saw myself, and I was like, oh, that's so beautiful, that you're seeing you, that the best parts of you are shining through. And and even my own experience, I had my nose done by my mentor at the end of my fellowship, and I was just more confident. Like, I just didn't think about that anymore. And my mom was like, oh my gosh, why didn't we do this soon? 'Cause
Right, no, exactly. I feel like, it's interesting that you talk about confidence just in general. So I think when you don't feel good, you don't necessarily project the right level of confidence. So I would suspect and love to have you expand on some stories just of how this has built confidence for you and also for your patients.
Yeah, and it, like you said, it goes far beyond just looking in the mirror in the exam room. They show up better for their partners because they feel good, they feel better, and it's so cute to see the little couple that comes in, and the husband picks his wife up after she's had something done, and they're so cute together because she feels good, and you know, you feel like you can, like I said, you just show up better for them, and work because everyone's different, but we tend to work longer now, and you don't want to be the youngest one in the room, and you don't want to be the oldest one in the room. You want to have respect, but you don't want that to take away from your credibility. So a lot of people will say, I just want to keep up with myself because I love what I do and I want to do it for a really long time, and I don't want that to be the discussion. And especially, it's funny, but especially men, they're like, I don't want to be the old guy in the room. I want to be thin, right? I know, because whenever I started this, like, hardly any men got anything done, but now they're like, yeah, I want to take care of myself. One of the guys said, well, I wash my car, change the oil, I put gas in it, I take care of my car, but I'm way more important than that. Why wouldn't I take care of myself,
A regular engine, right?
Yeah, exactly.
I love it. So, you talk about some of the outcomes and experiences that people have had. When you and your patient get together, you have a one-on-one, a pretty deep relationship with them, right? You've made this connection. From your perspective, what's the perfect outcome?
I love whenever they, like, the patient and me and my team, we can see a big difference. We look at the before and after, and we're like, wow, that looks so good. Like, your jawline looks amazing, your nose looks great, and we're celebrating and we're like, oh, this is so good. But whenever they go out, to dinner with whoever that doesn't know they've had it done, they either don't really notice or they can't put their finger on it. They're like,
Oh, well, you look like how good you look, but I don't know what it is.
yeah, did you change your hair? Or, I tell them, like, change your hair at the same time, and it gives you a great excuse. You're like, oh yeah, I just dyed my hair, or the guys just grow a beard and then shave it or something, so it's something's different. But that's the perfect to me, because you look like yourself, because that's always the worry with people are like, I don't want to do this and look weird or look like not myself or walk in and someone know that I had something done. The ideal is they don't know. The good plastic surgery, you don't pick up on it.
Right. I would agree. The subtlety is huge, right? So, when you see somebody and you're taking a step back because they've been so done up, that's not a real appealing outcome. But if they can feel more like themselves and more confident, and people just can't put their finger on it. Like, you look good. Have you lost weight? You look better. They just don't know and can't put their finger on it. That sounds like a perfect outcome to me as well. So now, I mean, if you're out there and contemplating surgery, plastic surgery. I mean, it's a big deal, right? I mean, it is a big deal. A lot of times people are paying for this out of pocket and prioritizing this, just like the maintenance of their car, their maintenance of their self. What advice would you give people? What should they be asking for in a consultation? What should they be looking for in a physician? Obviously, you're available. But would they be looking for in that initial consultation?
You want to find somebody that's board certified, so they're held to, the highest standard. You want to find somebody that does what you want to have done all the time. Like if you're looking for a facelift or a rhinoplasty, that's what they do all the time. And you can kind of tell by their before and afters. If they have a lot of what it is that you like, they statistically do that more, because the more you do it, the better you're going to be at it. And usually the more we like it. And we said surgeons, we usually like to be in the OR where we're not talking to anybody, doing our thing. I love both, I love both. That was one of the things I liked about facial plastics. I get both. I get to talk to the patient and have a relationship in the OR, but that's something they're doing all the time. And then they can tell you really, I love when people can tell you pretty specifically like what they're going to do, how they're going to do it, why they're going to do it that way, and have a really comfortable conversation with them before surgery, because afterwards we all want everything to go perfect and great and wonderful, but on the off chance that maybe there's something you're not as crazy about, or that you would feel comfortable bringing that up. I think the worst case is where you're like, ugh, I don't want to say anything, but you want to be able to say, well, what about this? What about that? And can we get it just as good as possible, and it be a comfortable conversation.
Absolutely. So making that connection, but also making sure they've got all the credentials to back it up and a lot of experience in the particular service, right? Because there's a lot of plastic surgeons out there, but maybe they just specialize in one particular thing and they don't really do it all. And you don't want to be their guinea pig, right? You want to definitely be the person who's going to somebody really experienced. So that is some great advice. If you were to leave us with a message, Dr. Sturm, just a personal message to anybody out there, what would you leave us with?
I think the personal relationships are so important, and I feel like that's something that we has been so evident in the past, what is it, 6 years now, of not being able to be around people and then coming back together. And it's different, life is different, but I think prioritizing that and prioritizing yourself and making sure you have supportive people around you and friends and all of those good things, is it just, and there's even studies that look at your quality of life, and your quality of life is better and your longevity is better, and it really is one of the most important things in life.
Wonderful take home message, Dr. Sturm. Can't wait to have you back real soon. You've been such a pleasure. Talk to you later.
Thank you so much.